Okay, thanks very much, Kara, and we're excited to be here. And because there's three of us, as Kara noted, we're gonna try to keep it tight and short, and just please do ask anything you want. There's so much in this study. There's no way we can come close to covering all of it. I've got Sheena's iPad. Somehow it appears like you've got the ability to draw on my slides. I don't know what's happening there, but anyway, my role in the study is I am the co-principal investigator with Lucy Pickering, and I'm going to tell you a little bit about the study and overview some of the key themes before I turn it over to my colleagues who will be speaking about particular cohorts that were involved in this work. So, about the study. This was a piece of rapid social research that was funded by the Chief Scientist Office. Its formal title is Scotland in Lockdown, Health and Social Implications of COVID-19 Suppression Members for Vulnerable Groups. It ran from June through December, so that's 7 months. We had to organize the study, recruit partners, recruit participants, conduct field work, analyze field work, and write it up. It's the fastest piece of work and the largest study both that I've ever been involved in my life. The study encompassed almost 4 mini studies. We had 4 distinct topical areas we were investigating, and those abbreviations are ones we use throughout our final report, which is available on our website, and they stand for the 4 groups of people with disabilities or health conditions, people involved in the criminal justice system, such as under supervision or in prison, people who are refugees or seeking asylum who are facing destitution, and survivors of domestic abuse or sexual violence. In some ways, it was quite serendipitous the way these 4 groups came to be part of a single study that had to do partly with logistics. The study was being organized as part of a larger medical school run group, and partly because those of us involved in the study were all in the sociology department, and while researching different fields, all wanted to act on looking at the experiences of an issue that all 4 groups shared, which is experiencing isolation and forms of exclusion prior to the pandemic. As a result of having this many groups and in order to try to accommodate the workload in such a rapid period of time, this was a really large team of 28 people, and that included 18 co-investigators, 8 RAs, and 2 part-time administrators. And that's interesting in itself in terms of trying to run rapid research. The study had 3 primary lines of inquiry that were embedded in our research questions. We wanted to find out, first of all, what were the impacts of COVID-19 for people in these groups we're interested in? What were their experiences day to day of dealing with lockdown? Secondly, we looked at levels of service provision and access, seeking both qualitative and some quantitative information about that. And finally, we sought to understand how information about COVID and about lockdown guidance was being accessed and distributed to people in these groups. We accumulated a massive amount of data. It's mountains of data. And just to highlight that, I'm going to pull in a table from our report, which shows the data that we collected. We conducted interviews of people in the situations we were concerned about. We interviewed staff working for organizations providing support to these groups. We had among our, I forgot to mention, we had 20 organizational partners ranging from large-scale UK national organizations to small grassroots groups. And in fact, our chair, Kara, was part of one of the grassroots organizations who was a crucial partner to this research. So we had partners conducted some kinds of data collection, including focus groups and community consultations. We did an online survey of service organizations. We did a very successful survey of people in prison, all sentenced, no remand. And we also received letters from prisoners about their experiences of pandemic. So you can see overall, the huge number of data sources we have, that doesn't convey the actual extent and amount of content we have. It's just a huge amount, and there's so much in it. And in addition to that, it doesn't even include all of it, because we also did a a kind of boost sample of people experiencing diabetes, because we knew early on in the pandemic that was a group that was facing particular risks. Okay, so I'm really just going to be talking about, and this is my last substantive slides, about some overarching themes and reflections of doing this work. First of all, as hinted at earlier, is just the actual unexpected value of us working across fields that normally are quite separate in research and have their own disciplinary, subdisciplinary groupings. And even though we came together in a somewhat serendipitous way, it came to actually be really valuable to have done this, to see very common shared experiences across people who are refugees, people who are experiencing long-term health conditions, people in prison, or whatever, and to thereby see issues that were not particularly distinct to a specific condition or setting of life, but flowed across them, but had quite specific dynamics in how those played out. And Michele and Marguerite will be addressing some of those. But one example I might give from one of our cohorts is the fact that we saw the extent to which people who were seeking asylum, who were accommodated in hotels, came to talk about their experiences in ways that almost seemed indistinct from the people who were in prison. So when they said, it feels like we're living in a prison, that actually was in some ways quite true because of the ways they talked about how they were able to move, how much autonomy they had, how much control was over their lives, and so forth. So the second thing I wanted to draw attention to, though, about working across these groups is the interesting and quite substantial way that actually there were overlaps in these groups. So in a dominant way, almost everybody in all of the 4 groups had a disability or chronic health condition. And we also saw issues of domestic abuse and sexual violence spread across groups. So for example, interviews conducted within the refugee stream were also analyzed within the domestic abuse stream because there is relevant material from that. So that really calls into question in some ways the way we've kind of disciplinarily organized ourselves and research to think about when we're talking about people with disabilities or long-term health conditions being at extra risk from the pandemic, we also are talking about specifically refugees, people under criminal justice control, and people who have survived forms of gendered violence. Okay, just moving right along. The substantive finding that cuts across all of the research groups is that the pandemic exposes and intensifies rather than creates particular inequalities and vulnerabilities. And this was a finding that was brought home to us again and again, regardless of the groups that people were brought in. The positions of actual or near destitution that many people found themselves in meant that once the pandemic struck, is that people were very much pushed to a cliff edge. And there were people who fell off that cliff edge, as we saw in distressing stories about what was happening in the asylum community and with deaths in prison, not just from the pandemic, but self-inflicted deaths. And this is a sign not of people not able to cope, but of people who already were living quite stressed and pressured lives, whose social networks were limited or themselves under stress, who had a great deal of those networks withdrawn or maxed out. And that, in some ways, then leads to a conclusion of the report, which is that the intensified inequalities that we saw across groups means that we expect and worry that people coming out of this pandemic will be in a worse position than when they went out to it, and in a worse position of coming back to a position of stability after it. And that is picked up in the idea that many people talked about the way their lives were stopped or stuck. Their lives were stalled out in terms of medical treatments, asylum hearings, and so forth. And I think my colleagues will be speaking about that in their groups as well. Okay. So a second finding was that we saw that there was a huge upswell of support from the public, from charities, from many kinds of services, and that was a lifeline for many people. But we also found ways in which forms of help, the way help was organized, actually diminished people's sense of self, it diminished their autonomy, and it diminished their dignity. An example of that was around issues of food. So food was a major issue as not just in the pandemic, but also as Marcus Rashford has illustrated in terms of the free school meals debate. But the way food was delivered through charity drops meant people were positioned in a way to be purely passive recipients in a situation of feeling grateful for it. So while they talked both about how they were grateful for and depended on things like food drops, it also felt like taking away their control and power over their own lives and the ways they had helped pre-pandemic other people. It turned them into victims. And that's something I would be happy to talk about, the kind of ambivalence of that. Secondly, though, we saw the ways that the pandemic was harming people in our groups also produced a response within these communities. So it wasn't simply that organizations rose up to help, it was that people themselves start to help themselves. And there were, for example, WhatsApp groups that were started. I think we have examples both from families of people in prison and from people in refugee communities, trying to get information to each other as quickly as possible in the language and forms of messaging that was accessible to their communities. And these are the human impacts, the quite intense front in your face impacts. The last substantive finding that I wanted to share across all groups was the massive movements in the landscape of services and support that occurred from the moment of the pandemic. And that happened in different ways. At the statutory service level, people talked quite a lot about the retreat of services, the loss of services, the contraction of services. Statutory services were experienced as shutting down or decreasing to focus on particular extreme or crisis level situations. And so that people who were otherwise reliant on services lost those. At the same time, the third sector really stepped up, and we saw both in our staff survey of support organizations as well as participants themselves, many, many examples of service organizations filling this void. But in particular, I would point out there was a distinction within the third sector service sector of different sized organizations. And what we really saw were the most community grassroots organizations, sometimes forming, but where they existed before, really leaping into the void and coming up with ideas, ways of adapting and so forth that could support people, for example, who are digitally excluded and couldn't access the shift to online or telephone services that some groups went for. Okay, those are just some of the major headlines from the study. I don't want to get into too many more, but there is so many things that could be said, and I just look forward to your questions at the end and this getting picked up. I'm just going to conclude by saying what also is interesting, if this group is interested in asking about it or emailing us about, was just the methodological challenges and to some extent opportunities, I think, of trying to do research with people who are highly excluded during a pandemic. I think we had some real successes there, and we had some real diverse ways of trying to adapt. And then secondly, this study for me was deeply interesting as a way of working, doing research under extreme pressures, where we started out from the beginning with an explicit commitment to the researcher Concordat, and we had a very specific and structured way of trying to support our 8 RAs as well as early career researchers involved in this work. I'm just going to close now by saying that we are in the process of anonymizing the data. We'll deposit it with the UK Data Service, so it will be available to anybody, and we hope that others do make use of it, because we know many of you will be involved in some ways in doing research looking at the experience of COVID. At the bottom there is the website for our study, where we have posted our final report, but also a huge number of briefings and findings and blogs that we hope that people will look at and give us feedback on. Okay, thanks very much. I'm going to stop sharing and pass it over to my colleague, Michele Burman.
Yep, everyone see that. As Sarah said, I was one of the co-leads of the domestic abuse and sexual violence work stream, along with Dr. Una Brooks, also of the University of Glasgow. I'm going to talk today about some of the high-level findings from the domestic abuse work stream. I'll start with talking about some of the impacts on survivors. Then I'll talk about some of the impacts on these support organisations that were adapting to provide support and assistance during this time. So to start with the survivors, there's little doubt that COVID-19 reinforced that home is not a safe place. And as Sarah said, domestic abuse is not caused by COVID suppression measures, but our research, like other research around the world on this matter, found that lockdown measures tend to intensify abuse and also intensify the challenges faced by those experiencing abuse. Lockdown provides opportunities for increased control of women's movements and new ways to do that. The use of digital technology, for example, to harass and intimidate, the use of lockdown restrictions to manipulate and control behaviour, exploitation of child contact arrangements, all of these provide a new repertoire for perpetrators. Like many other studies, we found that social isolation for those experiencing abuse increased during this time. And this is a group that tend to be socially isolated anyway. And along with that increased social isolation comes the depletion of existing support networks. Limited contact with more extended family, limited contact with social or community-based support networks, which all contributes to this increased isolation. Many of our participants talked about the triggering effects of lockdown, that aspects of lockdown mirrored their own experiences of abuse and exacerbated the situation for them. For example, the use of masks mirrored respondents' experiences of strangulation and suffocation and was an exacerbating factor. Also, lockdown restrictions create barriers to reporting and help seeking, which in turn compromises survivors' ability to access justice as well as support from both statutory and third sector organisations. Economic difficulties were compounded during lockdown, are compounded for many of the respondents in our research, where they were more financially constrained and due to not being able to work and due to some financial economic abuse perpetrated by their abusers. Many spoke about the impact of children, and in fact this was a common finding across all of the groups, is around what lockdown measures were doing to children. Particularly for our group, there were safety concerns had increased. The lack of breathing spaces, lockdown removed safe breathing spaces, schools closed, support avenues were blocked, and there was no kind of opportunity for children to have access to other children, teachers, leisure facilities, those kinds of things. But also there's a lot of discussion around the manipulation of child contact arrangements by perpetrators and abusers during this time, and raised also child protection concerns. In terms of the impact on support services, of the support agencies that we spoke to, many had experienced initially a decrease in the number of calls for their services, but this was quickly followed by an unprecedented demand for assistance. In terms of helpline calls to organisations, increases in volumes of calls and cases, but also an increase in the complexity of need. Practical assistance, financial assistance, food concerns like those raised by Sarah earlier. Clearly, we have insufficient refuge provision in Scotland. We're already below the Council of Europe recommendation for refuge provisions, but also during lockdown periods, there is limited move on, people moving on from refuges because of the pandemic situation. Service providers spoke to us about a lack of access to permanent accommodation and their real concerns around potential homelessness of those that they're supporting. Safety concerns were increased amongst service providers for those for whom they were providing support, as well as their children. As Sarah said, support agencies, particularly the grassroots ones, the community-based projects and organisations, had to really rapidly adapt and radically redesign all aspects of their work. For some, the plugging gaps left by this contraction of statutory services that Sarah mentioned in the beginning. And this was due to the necessity of meeting basic financial, technological and food needs of survivors, meant that there was a move away from what might be termed a kind of more therapeutic forms of support to much more practical provision. The drawings on volunteers to actually do that work as well was common amongst many organisations. We found across all of the 4 work streams that the support organisations on the ground proved highly innovative in their response. Very, very flexible, very, very agile, but there is a limit to this. And it really raises questions about longer term sustainability in the medium and the longer term coming through the pandemic, and how whether that change of emphasis can be sustained, should be sustained. So real questions there about that. The other issue is that the service provider staff resource diminished at the same time during this period as well. And we are largely due to sickness and having to undertake other caring responsibilities, homeschooling. This is for the most part, a highly gendered workforce, heavily reliant on women workers and women volunteers. And we know that women are overburdened in the domestic sphere, and we know that COVID has had major implications on women's work and caring responsibilities through this time. So we saw that replicated through our service provider responses as well. So at the same time that they were having increased demand on their services, having to rapidly redesign, they were also experiencing a diminution of the workforce because of the COVID situation and ill health and caring responsibilities. This created immense capacity issues and increased pressures, and also led to stress and concern and effects on well-being. But it also affected efficacy of service as well. And it was really extraordinary how support organisations really rallied. Some were working together for the first time, pooling resources in order to try and meet this necessity of need. At the same time, because of this diminution of resources and because of staff decreases, some multi-agency work was compromised. So in this field of domestic abuse, some of the real concerns were about the impact on the MARAC proceedings. This in turn has an impact on the management and the assessment of risk in domestic abuse. Another big concern for those in the support agencies in the area of domestic abuse was the consequences of disruptions and delays in the criminal justice system. This had a knock-on effect on survivors, but also on support organisations. We know that there is continually a large backlog in criminal proceedings. During the time of lockdowns, the pressures on the prosecution services, we have seen court closures and cessation of court business. We've seen delays in civil family courts. This has a real impact on child contact matters and decisions. And these are huge concerns and worries for both survivors and for those who are supporting them. Workers that told us that how they were also trying to ascertain the current legal situation relating to those who they were trying to support. The uncertainties caused by delays and rescheduling had a massive impact on the health and well-being of service users. We anticipate that it's likely to lead to the increase in attrition as survivors disengage from criminal justice and civil processes. There is also the issue of unpredictability that service providers raised. Is about, at the time that we were doing the research, we didn't know that we were going to go into this next phase of lockdown, but they were already raising concerns about what the implications of further lockdowns would be, how they would be able to readjust and readapt through that process. I think what we are seeing here is that COVID exposed the consequences of long-term spending cuts on statutory services and also on community-based providers. This has had an effect on capacity, on the ability to deliver services, and on overall financial stability. The support sector, certainly in support of domestic abuse and sexual violence, but also in the other work streams, rests on a very fragile framework of services that patch together funding from national and local government, from charities, and also from public generosity, which was really immense during the period of research. We did see a lot of public giving to organisations. I think it's important to remember, in terms of some of the community-based services, they're already struggling to meet demand pre-COVID. Some of the funding arrangements to support these organisations are highly unsatisfactory. They survive on short-term, uncertain funding. Funding comes with incredibly bureaucratic requirements and reporting arrangements, and this disadvantages some organisations. So even though that we did see some government funds, quite substantially, going to some organisations, that kind of funding model can disadvantage some organisations, and there are issues of funding proportionality and equitability that I think require to be addressed. Organisations that were trying to adapt and change have already in acute financial difficulty. They have limited reserves, and they were trying to use those limited reserves to, for example, distribute phone top-ups, to undertake food drops, to do all of these kinds of practical things that we've been talking about. So I think that there is real concern around the longer term effects. What is the future scenario going to be like? Whilst the emergency is now, there are really significant implications for the longer term. In relation to domestic abuse, we know that from the Women's Aid in England and Wales surveys that have been conducted, that it's around 6 years before somebody who's experiencing abuse makes that report, seeks that help. So thinking about that, we're thinking about this period of time, we might see through beyond this pandemic, this increase in demand likely to come through. Likely to continue to increase post-lockdown. So these questions of sustainability for these hard-pressed community organisations remain particularly acute. And I think, just to finish, as Sarah said, I think what we have seen in this research across all of the work streams is that we've seen a massive impact of COVID, lockdown suppression measures, on the disadvantage, but also on disadvantage of already marginalised and excluded groups, but also impacts on their health and well-being, and particularly in this work stream on those experiencing domestic abuse and those trying to support them. So I'm going to hand over to my colleague Marguerite now, but along with Sarah and Marguerite, we'll pick up any questions at the end. Thank you.
Thank you, Michele. I'll just get up my slides. My name is Marguerite Schinkel, and I was the co-lead on people who were involved in the criminal justice system, so whether they were in prison or under supervision in the community, with Dr. Caitlin Gormley. So we weren't able to speak to people in prison directly, but we conducted a prison survey. So this is where we got most of our data from, and also people sent us letters and letters to one of our partner organizations. So really a very strong finding that we had was that people within prison especially felt that they were kind of institutionally abandoned, but also societally to some extent. So that was partly because they were, because of the length of time they were locked up every day, which tended to be more than 23 hours. And also the way in which that kind of constrained their choices. So that with the little bit of time that they had every day, they had to make choices, for example, between phoning family or speaking to other prisoners or sorting different things out. So it felt that they could only make bad choices in those circumstances. They were also very much constrained in their autonomy. And especially that was noted, and that's anyway the case in prison, but here this was exacerbated by COVID and the way that people felt they didn't have the option really to keep themselves safe. So they didn't have access to good cleaning materials. They only were able to go and have a shower once in a while. So that made it really difficult for people to feel in control about COVID. And then one thing that really was highlighted in the survey was the access to services and how they were diminished, and especially mental health services. When people were struggling with their mental health, people described how even when they were quite acutely unwell, they weren't able to access the support that they needed. So one quote that sums all this up is from a prison survey, and that said, we are the forgotten people of the COVID-19 pandemic. There's been no compassion shown to us as human beings. And then another person commented that the media don't care unless there is a death in prison. And that is some kind of juxtaposition with the people, survivors of domestic abuse, who were quite highlighted in the media as a vulnerable group in relation to the COVID pandemic. And that wasn't the case in the same way for people in prison. People who were supported or controlled by criminal justice social work outside the prison really related, as did other larger organizations that Michele's already talked about, that contact kind of diminished to phone calls. And some people, especially those who were on a long sentence and were so unlicensed after their sentence, welcomed that. But other people who were really relying on their criminal justice social worker to kind of link them in with other support organizations, or relies on groups that were run by criminal justice social work to see other people, felt that they were kind of left without support in that context as well. And both Sarah and Michele have already talked a lot about how the very small organizations stepped in to the breach to fill some of the gaps that were created by the withdrawal of the larger and statutory organizations. And we spoke to organizations that really were providing all the necessities for people on release from prison. So that's not only food, but also like mobile phones and mobile top-ups. They were really actively adapting to the situation. And that included one organization, for example, that so far had only worked in prison, to start providing support outside of prison and setting that up from nothing, to making that quite a big part of their work. The smaller organizations were also much better at facilitating face-to-face contact, and that could be, for example, through distance walking groups. So still staying within the COVID regulations, but in a way that the larger organizations weren't able to organize. And there's also a sense in which they were holding people safe for the larger and statutory services. And I've got one quote on that. So one of the people, the staff that we spoke to from a really small organization said, like, this woman contacted me at 12 o'clock in the afternoon in absolute crisis, suicidal, telling me that she didn't feel safe. She was going to bed praying that she didn't wake up. And so I got right on the phone, contacted her care manager at the addiction team, but the whole day she didn't get back to me. I then contacted the CPN at 5 o'clock. So I had to phone 111 to do that. And the CPN actually contacted that individual at 20 to 12 at night. So this is somebody who's been holding this person safe for 12 hours before larger organizations were able to step in. What we also really found was a sense of suspension, and that in prison was for some who have to be released by the parole board, of progression towards freedom. So they weren't able to take part in courses. They weren't able to be transferred to the open estate. They weren't able to go on the visits to the outside that they would usually get. So one person said, our sentences have been paused during this pandemic with no support or rehabilitation being done. Then very seriously as well were the court cases, which affected the victims of domestic abuse, but also people who are waiting for their case to be heard when they're the defendant. So a staff member said, we've got clients that may have been on bail for a significant period of time or been on remand and they're still waiting. And that's causing a lot of anxiety, and not just for them, but for families, court dates just being cancelled. So there's this really significant date that you're living towards, and especially when you're on remand in prison. But so this is just stretching things out again. For some people, it felt like there was maybe a suspension of the control element of their relationship with the criminal justice social worker, and they didn't necessarily find that difficult. But again, like I said, for others, the support also went missing. But there was also the suspension of graduation from community sentences. So people described to us how like community sentences were just ongoing, but because the contact was so minimal with criminal justice social workers, it didn't really matter. But that does raise the question of what happens when somebody hasn't officially graduated, but they commit an offense or they do something else to breach their conditions. After it should have stopped, then what are the consequences of that? So in general, we found that there was a significant increase in the duration of sentence and remand. So that's beyond what the judge will have imposed, and that's just a consequence of this pandemic, but also in the depth of punishment and the weight of punishment. So the depth of imprisonment has been characterized as how far away from the outside world you're being kept, how much contact you have with the outside world. And that's obviously really been affected by the pandemic, with very little contact with families and very little interactions, even with prisoners, by being locked up in your cell. And the weight of punishment has been, or of imprisonment has been characterized as how survivable the conditions are and the relationships that are happening with staff. And these are also very negatively affected. So imprisonment, like all the pains of imprisonment have kind of been exacerbated, but there's been no consideration of the fairness of this. And that's me. Thank you very much.